Hi, my name is Dr. Robert An from the Asian Eye Institute in the Philippines, and I'm here to present my paper on 3-year visual acuity results following cataract surgery and implantation of a small aperture IOL. I am an investigator and an advisory board member of AcuFocus. In this study, we wanted to find out what is the long-term effectiveness and visual acuity results after implantation of the small aperture IC8 intraocular lens. We did a non-randomized prospective study. We recruited 22 subjects, 32 eyes. 12 subjects were implanted contralaterally with an IC8 and a spheric monofocal IOL. Now, 10 patients were initially implanted the IC8 in one eye, and after a modification of the protocol, uh, we found out that these 10 patients were requesting an IC8 in the other eye. So we amended the protocol to accommodate these patients to have bilateral implantation. And in this study, we wanted to compare what is the visual performance of patients with an IC8 in one eye only, with a spheric monofocal in the fellow eye in one group, and compare them with a bilaterally implanted IC8 IOL. So we checked for binocular and monocular distance, intermediate, and near vision, and patient satisfaction. And we have follow-ups all the way till 3 years. So in terms of results, you see here the slides. The uncorrected distance vision is blue, intermediate vision is red, and the uncorrected near vision is green. So the mean refractive spherical equivalent of the eye is minus zero point 0.4 diopters. And in the distance eye, so the reason why there are two different MRSEs was the distance dominant eye. So we checked the dominance of the patients prior to surgery, and we targeted the distance dominant eye to near plano, whether we implant an IC8 or monofocal IOL, and the non-dominant eye to minus zero point 0.5 diopters. And as you can see, we are near the target. At the last visit, about 3 years post-op, the uncorrected distance visual acuity was about 0.04 or 20/20. The uncorrected intermediate vision is about 0.16, and the near is about 0.11, which are uh, 20/20 distance intermediate and about 20/25 near vision. What about binocular? So binocularly, all patients performed spectacularly well. Distance vision was very good, 20/20 at 0.03. Intermediate vision was 0.02, which is better than monocular. And near vision is 0.10, which is again better than monocular. So the binocular uncorrected results were all better than the monocular uncorrected visual acuity results. Now, what about visual symptoms? So we tracked the visual symptoms, especially patients' perception of glare, halos, and night vision. So we started the questionnaire pre-operatively. You see that the patients do have these symptoms pre-op, and over time you see that the patients still had these visual symptoms, but on all three metrics, glare, halos, and night vision, the symptomatology is less than pre-op. Uh, Night vision is about the same, and halo is about the same, but glare is less. So patients pre-op have some glare, and with the IC8, they have a little bit less glare, but patients are generally um, asymptomatic. How about patient satisfaction? So on a scale of 1 to 7, you see that uh, from 3 months onward up to the last visit, patients were very satisfied, 6 out of a 7-degree scale. So patients are quite happy with their vision results. One of the questions always asked about small aperture optics is contrast sensitivity. Are we sacrificing contrast sensitivity because of the small aperture? Less light would go into the eye, and does this affect contrast sensitivity? So In terms of monocular photopic contrast sensitivity, you see that there is some mild difference wherein uh, monofocal IOLs perform slightly better at the 6 cycles per degree spatial frequency in both photopic contrast without glare and with glare, but all other metrics about the same. Binocular, again, very slight difference, but no statistical significance, both with and without glare in terms of photopic contrast sensitivity. What about mesopic? So in dim light conditions, you see that first, the monofocal IOLs, of course, perform better than the IC8 eyes in terms of mesopic contrast sensitivity with and without glare. However, binocularly, when you combine the two eyes together, the mesopic contrast sensitivity without glare is very similar, whereas only that with glare is slightly better in the contralateral group at the 3 and 6 and 12 cycles per degree. So there is a little bit of uh, better contrast sensitivity mesopic-wise in the contralaterally implanted eyes. So in summary, the IC8 extends depth of focus, so the mechanism of action for presbyopia correction of small aperture IOL is EDOF, but the first vision results remain consistent over time. The patients achieve very good monocular and binocular outcomes for distant, intermediate, and near vision, meaning this gives us very good presbyopic correction. The patients report low symptoms in terms of glare, halos, um, and they have high patient satisfaction. Photopic and mesopic contrast sensitivity testing shows very similar scores, except for mesopic, wherein the monofocal performs slightly better than the IC8, but overall, not much difference. Now, when we do bilateral testing, contralateral and bilateral groups achieve comparable photopic and mesopic contrast sensitivity results. So, in conclusion, uh, implanting the IC8 in one eye or both eyes both result in high patient satisfaction. Thank you.